All right, well, welcome to this morning's coffee talk. We're going to be talking about study tips for nursing school and determining your learning style. So let's just jump right in. So, when we think about study tips for nursing school, one of the things that you've got to do is because there's a lot of moving parts, is use a planner, use a calendar. Sometimes we can use it like a Google Calendar. I myself, I prefer to have a paper and pen kind of master calendar that I write everything down on. Sometimes folks use apps on their smartphones that give them, reminders. So let me ask you, Shaka, what kind of calendar do you use?
I have a planner. I actually have two planners. I have one for like personal things, and then I have one for school.
Okay, great. So you've got a system that works for you. That's fantastic. And so the other thing, once you have your planner, and it sounds like you've already mastered that part, right? Develop a
Yes.
study schedule, right? And so we have to think about, okay, the time that's blocked off for classes, we go ahead and block those off. And whenever you have a class, that same day of your class, it's always best to review your notes because that's when everything is going to be the freshest in your mind. And when you review it again, and even if you could review it a second time, even before bedtime, there's more likely that it's more likely that that information that was reviewed in class will stick. Okay. Also planning ahead, right? And so kind of allotting your time for certain activities, that's going to be really, really important. Carving out time for your studies and relaxation. We all need some downtime, even if it's 10 or 15 minutes to do something that you love. It might be sitting down with a cup of tea, but something that relaxes you. So let me ask you, Shaka, what do you do to help you kind of relax at the end of the day?
I like to read, so I take like certain times and I'll read to try to get my mind off of school to get it onto something that it my something that relaxes me. So I'll read a little while.
Okay, excellent. All right, awesome. So it sounds like you've got those things already set up. All right, so let's talk about study tips. How do I study for nursing school? Well, one of the most important things that a student can do is to read the assigned chapters before class, and that's going to be going by the class syllabus, right? The course syllabus. So, and if you can't necessarily read all of the chapters, I'll tell you how you can actually at least become familiar with what's going to be discussed in the class. If you can't thoroughly read the assigned chapters before class, you can look at the heading, look at the introduction, at least know, okay, these chapters are over the respiratory system. So we're going to be talking about the respiratory system today. So you can kind of get your mind set, okay, trachea, lungs, bronchi, asthma. So you can kind of get your mind kind of ready to receive that information. One of the other things that you can do to in order to get you ready for your lecture is to read the end of chapter summary because at the end of the chapter that tells you, okay, this is what you should know after reading this chapter. And another thing that you can do is to help you is to look at the chapter objectives that are at the beginning of the chapter and if you're able to read the chapter, go through those objectives and say, okay, when I'm reading, I'm supposed to find this objective, okay, and then this objective. And if you're kind of a highlighting person, you can even make notes inside of your book. Hey, this is objective number one. Let me go ahead and highlight this, make notes on it, right? And like, okay, I understand objective number one, and go all the way down with all of the objectives, right? The other thing that you can do is you can test your knowledge by doing those questions at the end of each chapter to see, did I really understand everything that I read? The last thing I'll mention is come to class with at least one or two questions from the reading. So that's going to do a couple things for you. Number one is going to tell your instructor that you are prepared, that you've been looking ahead, and that's always a good thing, right? Also, it's going to get your mind engaged on the topic of the day, right? So it kind of gets you, using that critical thinking, that intellectual curiosity that we need in order to be successful as nurses. Okay, so Shaka, let me ask you, do you have any questions about these study tips, or maybe you've done these already and you found them to work for you?
No, this is great information. I'll start doing this for sure.
Okay, awesome. Well, I'm so glad that you're here, and we're going to pass this on to all of our nursing friends so they could be successful. All right. So study tips for nursing school. And now we're going to get into, the personal stuff. We're talking about distractions when studying. So we probably all use social media of some sort, right? It could be Facebook, Instagram, Twitter. I'm not sure what the new things out there, WhatsApp, whatever is out there. Those are distractions, right? So when you are studying and you're setting up your time, okay, this is my time for studying. My children are safe, my family is safe, I'm in a quiet place. I'm going to turn off my phone, right? Tell my family, leave me alone, I'm in my room, don't bother me unless it's an extreme emergency, right? So no texting during that time. And if it's possible also, right? No social interactions during that time. When I was in nursing school, I would just go to Starbucks, and I didn't know anybody in Starbucks, and so they didn't know me, so I was just able to focus while I was there. Right. Now, the other thing that may be required for nursing school is to decrease working hours. I know for some people that's just not possible because they could be a single parent. They may, be the breadwinner of their family, so that may not be possible. So we're balancing a lot of things. But one thing that you could do is just let your job know that I am in nursing school, so I might require some flexibility. That could be something to let them know so they can kind of work with you. Okay. Any question about this particular section, Shaka?
No, ma'am.
Okay, well, let's continue. So this is something that I found extremely useful when I was in nursing school is multitasking. So what does that mean? I would be listening to videos. I really liked the Hearst Review when I was in nursing school. I would listen to her videos over and over and over again while I was folding laundry, while I was cooking, or when I was driving. I would just keep listening to these videos. So there's a lot of different videos that you can use, and you can listen to those while you're working out and everything else, right? So that's one way, especially if you're an auditory learner. Now, if you're an auditory learner, we're going to get into the different kinds of learning styles in just a few minutes. This is going to be really good for you. And what you might want to ask your instructors in the classroom, is it okay if I record your lecture so I can listen to it over and over again? Now, when we are multitasking, we're maximizing our time. And so we have to kind of be creative. One thing that I did was I made flashcards and I would just post them throughout the house. Another thing that you can do when we talk about multitasking, because we do want to spend time with our family, but we want to study. Well, those flashcards, your family can quiz you, right? And so they can even learn along the way. I will tell you that my husband learned so much when I was in nursing school because I would repeat it over and over. I would have him quiz me, right? And so just incorporating the family into your studies, they can quiz you, and you can even make it fun because, you can say, okay, if I get all of these questions right, then you all will have to treat me to ice cream, or, vice versa. If I miss some questions, then I'm going to have to treat you to ice cream, right? Just some fun ways to incorporate your family into your studies. Okay, any questions about this multitasking?
Could you tell me what that site was that you said that you looked at nursing videos?
Oh, yes, absolutely. I will post those in the chat, and I
Okay.
will share all of those sites with you. That's a great question. So just remind me
Okay.
when we get to the end. All
Okay.
right, awesome. That's a great question. All right, so the other thing that's really going to be helpful is using a study guide because I know that sometimes it is challenging to read all the chapters, and I'm not saying not to read all the chapters because sometimes we read all the chapters, but there's just so much information we don't know what to focus on, right? Especially if you're in a class like pharmacology where the instructor will cover 7 chapters in each class setting, right? That's a lot of information. So if you use a study guide, that can help you focus on the most important things. What are the most important things? Well, that study guide is going to help highlight it. Now, when I talk about study guides, some of your textbooks come with an actual study guide or workbook. Those workbook exercises are going to help you focus in on those most important things that you need to know. Also, sometimes your classroom instructor will give you a study guide, right? So that's something that you can always ask your classroom instructor. And you should also have your HESI book and your Saunders book. Those books are excellent study guides that are used by many nursing schools, right? So the HESI book kind of gives you a breakdown of the nuggets of the things that you need to know. And the Saunders book does the same, and associated with the Saunders book are going to be NCLEX style questions, which are going to be essential as you break down those questions, you break down the content, and you will be able to do those questions to test your knowledge before your instructor even tests you. Okay, so these are just some important things about using study guides and the resources that you have available. Any questions about this?
No.
No? All right, great. We're going to jump into learning styles, okay? And so when we talk about learning styles, it's how you best receive information and how it sticks with you, right? So let's talk about the different learning styles. There's visual, auditory, kinesthetic, and then read, write learners. So when we talk about visual learners, they need more, right? They need to see it. They need pictures, right? And so this kind of learner, I find when I'm teaching in the classroom, I use some visual aids, and I'm going to share those with you at the end because it kind of helps them make everything solidified. And a lot of times, these illustrations, these diagrams, these even cartoons help the student to retain the information because they can close their eyes and they can see, okay, wow, congestive heart failure, this is what the patient looks like. So a lot of times during my classes, I will pull up pictures. It could be like a clip art kind of picture, or it might be an actual real patient, right? So here's another example. If we're talking about pressure ulcers, I'll bring up actual pictures of wounds and pressure ulcers and talk about the different staging of those ulcers. And I will tell you, if you are a visual learner, that's going to be a good thing for you to do. Even if your classroom instructor doesn't necessarily do that for yourself. Pull up pictures on the internet. If you are studying, respiratory failure or asthma, COPD, pull up a picture on the internet and see what does that patient look like? Because when you have that picture in your mind, when you go to clinical and you see that person, that patient, you're like, oh, wow, these are the things that I read about. These are the things that I studied. And then everything's going to start to kind of mesh together. Okay, so that's if you're a visual learner. Let's talk about auditory learners, which I kind of talked about a little bit before, right? So this is the student who loves to listen. Maybe you listen to audiobooks, right? Maybe you listen to others that are reading their notes, right? You just absorb things by listening. Now, this student may love podcasts, right? The auditory learner. And study groups are going to be really a good thing for your auditory learners because discussing, right, exchanging, dialoguing with your fellow nursing students, that's also going to be helpful. Something that is also helpful for the auditory learner is when you're reading those chapter summaries, record yourself, right? Reading aloud and play it back over and over so you can hear that information again and again. Now, read write learners, these are really interesting learners because they have to write their notes over, they highlight, they make index cards, right? They may have to write their notes over and over and over, right? This is a student that may do journaling, right? So they really just have to read and to write, okay, in order to process the information. And this may take a little bit longer, but that's just the way that they learn and they retain information, okay? All right, any questions so far?
No, ma'am.
Oh, all right, so let's go to the kinesthetic learners. A lot of times we'll find that nursing students are kinesthetic learners because they have to touch, they have to feel, right? They have to have hands on a patient or hands on a mannequin, hands on their equipment, their stethoscopes, right? So, and this is great. If you're a kinesthetic learner, you know, you might have to find activities that will help you get your body engaged, right, as you are learning. So what I do sometimes for my kinesthetic learners, if I'm teaching med surg and we're talking about the cardiovascular system, I'll bring in a heart model and I'll pass it around the class so they have a chance to put their hands on something. They can, you know, explore it in that way. So just it's really important to understand the different learning styles, right? And how you best absorb the material. So let me ask you, Shaka, based on these different learning styles, what do you think your learning style is?
I think I'm a combination of the read write and the kinesthetic.
Okay, fantastic. So now that you know and you have established, okay, this is how I best learn, that's going to be the most effective way for you to study. I would submit to you to let your instructors know, you know what, classroom instructor, I am a read write learner, I am a kinesthetic learner. So anything that you could do to incorporate that into your lectures or any tips that you could give me as we go over these different topics would be very helpful. And so when I find that students, you know, have those learning styles, I make sure I try to focus in on, hey, this is for my visual learner. This is, you know, I'll mention that because sometimes, you know, you're lecturing, students may not understand, hey, this is for my learning style, right? So, but if you make your instructor aware of it, at least, you know, they will try to appeal to your different kind of learning style. Now, for some, you know, you may not necessarily be able to do it, especially for the kinesthetic if it's more of a lecture, but you never know because sometimes instructors can have like fun classroom games or, you know, different activities that can help the kinesthetic learner. All right, so far, we talked about study tips, how to be successful in nursing school, what is your learning style. So the next thing I want to do is, with the time that we have remaining, is to go over some NCLEX kinds of questions. So you may not be familiar with the content yet, but that's okay because we're going to break down these questions and help you start developing strategies. So when you get these questions for quizzes, for tests, for you know, your HESIs, that you'll be familiar with this critical thinking. Okay, so would you mind reading this question for me, Shaka?
Which individual is at the greatest risk for developing hypertension? A 45-year-old African American attorney, 60-year-old Asian American shop owner, 40-year-old Caucasian nurse, 55-year-old Hispanic teacher.
Okay, excellent. All right, thank you so much. So let me ask you, what is this question asking you?
Um, the words that are popping out to me are the greatest risk in developing hypertension.
Okay, yes, excellent. So the greatest risk, so out of all of these patients, who is going to have the most risk? Who's the most likely to develop hypertension? Hypertension meaning high blood pressure, right? We know that normal blood pressure is 120 over 80, right? So we're looking at this. And so do you have any thoughts about these different individuals that are listed?
I want to take a guess at the answer being A. I think African Americans have a greater risk for hypertension versus all of these other um, groups.
Okay, excellent. Okay, so that is correct, right? And so that 45-year-old African American attorney, right? And so African Americans develop high blood pressure at younger ages than other groups in the United States. And so also African Americans, they do respond differently to hypertensive drugs, right? These antihypertensive drugs. So that's going to be something that's important to note. That's going to be important. You're going to find that when you're in your pharmacology class. And African Americans are more sensitive to salt, right? And so now we have to look at the dietary habits, right, of that African American because increased consumption of salt can lead to a risk factor, right, for developing hypertension, right? So you knew the answer to this question right away, right? Because of the background and the content knowledge that you had, and that's excellent. Now, one thing I will also tell you is when you do these practice questions, always look at the rationale. Why is the correct answer the correct answer? Because you're probably going to see that question again. They may ask it in a different way, but you're still going to see that question again because the content is the content is the content, right? The other
Yes.
Perfect. Now, the other thing is looking at the different answers that are not correct, you want to look at the rationale as well. And why isn't that the correct choice, right? So, because you might see that as part of a question again, right? And so when we look at options B, C, and D, it tells us that those populations, they're not significantly higher as far as risk for hypertension, right? And so it's really a great idea to look at the entire rationale. Okay, any questions about this?
No.
All right, question number 2. Would you mind reading this one, please?
A 15-year-old female who ingested 15 tablets of maximum strength acetaminophen 45 minutes ago is rushed to the emergency department. Which of these orders should the nurse do first? A. Gastric lavage. B. Administer, I do not know how to pronounce that, orally. Start an IV dextrose 5% with 0.33 normal saline to keep the vein open, or have the patient drink activated charcoal mixed with water.
Okay, excellent. Okay, so for B is acetylcysteine or Mucomist orally. Okay, so fantastic. So let me ask you, Shaka, and thank you for reading this. What is this question asking? What kind of scenario is it painting for us?
This is about the nursing process.
Okay, so it is a nursing process, and I like the fact that you said that because we always have to think in terms of the nursing process. Okay, and so what do we see is going on with this patient?
Let's see, she ingested 15 tablets, so I'm thinking possible overdose, correct?
That is correct.
Okay. She's rushed to the emergency department. Their maximum strength, and they've been in her system for at least 45 minutes.
Okay. Okay. Yes. Yes. So you're breaking it down and hopefully you're painting a picture. And what I like to do with these questions as they are unveiled to me, I close my eyes and I think, okay, I'm walking into the room and I see this particular patient, right? So I'm looking at a 15-year-old young woman and she's taken these, extra strength acetaminophen. I'm thinking, man, I'm concerned about her liver. And this is 45 minutes ago. So it's relatively recent, right? So
Yes.
this is a prioritization question because it says what should they do first. So out of all of these things, they may or may not be good things to do, but what is the most important thing for me to do to counteract what has happened to this young lady? Okay, so the gastric lavage, when I think lavage, I think leaving. So that is going to be removing the contents of the stomach, which would be those 15, tablets. Now, acetylcysteine is the antidote, right? Should I give the antidote first? Should I start this dextrose solution to keep the vein open? Should I have the patient drink activated charcoal mixed with water? What is the correct order for this? Well, let's take a look. The first thing is going to be gastric lavage, okay? I need to remove as much of that acetaminophen, right, that I can, right? Because I am concerned about liver damage. And now I need to also understand that the signs and symptoms of liver damage is going to be the nausea, vomiting, abdominal pain, diarrhea. And if this is not treated immediately, right, now we're looking at liver necrosis. That means death of liver cells and liver tissue, right? And that could lead to the patient's death. So we've got to remove these acetaminophen tablets, right? And then we're going to go through, the other steps. But the most important thing is to remove those tablets. Okay. Any questions about this so far?
No, ma'am.
Okay, so this is one of those questions that all of these choices are something that you would do because we will eventually want to give the antidote, but that is after, we'll give the antidote after the stomach contents have been emptied. We want to possibly give this dextrose 5% solution that is for late presenting or chronic ingestion. So this was like we said, it just happened. It's 45 minutes ago, right? So that dextrose 5 is for chronic ingestion, or if it's been, a long time, a number of hours. Now, option D, that charcoal, right? That's going to be done after we empty the stomach. Anything that's remaining, that charcoal, right? If we get them within 1 hour, that can help to actually absorb anything that is remaining. Now, it's also important to understand that the charcoal will actually absorb and neutralize any other medications that's given. So if the antidote is given, right, the charcoal will actually also absorb the antidote. So we have to be careful with the timing of that particular giving the patient activated charcoal mixed with water. All right. Well, I'm going to stop the recording here.